woman presents to her GP with a positive pregnancy test after congratulations, we tend to talk them through the options for their pregnancy in terms of what we can do, investigations we may need, and what sort of care the woman might want through their pregnancy. When the woman comes to me and expresses her interest in having a home birth, I would then put a referral into the hospital for her to be considered for that. Then that will get looked at by the obstetric team or a midwife, and we've decided if she's eligible for a home birth.
The types of women that would like a home birth are healthy, motivated, they've got no complications in their pregnancy. We expect that their babies are going to be born healthy and they're motivated to have a natural birth.
I want to have a home birth because I've been quite influenced by the stories of my friends and family who have had really positive home births. I am involved in the midwifery group practice where I have a midwife that's been assigned to me that I've seen throughout my whole pregnancy, and I've just had that continuity of care from one midwife the whole time, and I don't need to rely on her and ask her every 5 seconds, you know, is this right? She's given me the power to know what's happening.
We would do the usual checks that we do for any pregnant woman, check her blood pressure and that her baby is growing well and do all her bloods as normal. So it would be exactly the same, but we would just need to make sure that she was staying in that low risk category. She would need to consider whether she feels safe at home, comfortable at home, and if she feels that she won't be requiring extra pain relief options that aren't available at home.
For me, it's birthing at home would be the safest place where I have my dog, my family, my partner. In a hospital, I don't feel I could really let myself go, and that actually might have some implications on my labour.
Part of a woman's birth plan, and as the baby's close to coming, the woman will choose to make the house as comfortable as she would like. So she could have music therapy, she could be in the bath, she could be in the shower. We will accommodate and enable her to birth that baby as she wants to.
The biggest plan that I have in place is to have a water birth. It's your own journey, you're in your own home, you've got all your comforts. I don't have to worry about getting back to my dog. I've got higher chance of breastfeeding success. During
a home birth, the woman will go into spontaneous labour, will be triaged over the phone. Once she feels she needs that additional support, the midwife will go to her house and set up and continue to observe her during the birth as we would in the hospital.
We would expect that the mum and baby just stay at home after the birth if everything goes to plan. And then we can do all the postnatal care from home after birth as well.
The role of obstetrician at the time of home birth would be to provide additional support for women who requires additional obstetrics care. Our midwives will be the primary carer for the women in labour, and we all work as a team, but in the hospital, being the obstetrician on call, will be made aware of any concerns that our midwife has for the women when she's in labour.
We have really good relationships with the Queensland Ambulance Service, and we have procedures in place to facilitate that as smoothly as possible and in a timely manner.
The Queensland Ambulance Service has been involved. We have seen a group of very professional, dedicated, caring people come together and demonstrate a program that can be put in place. It's going to take birthing into the community, but doing it in a way that's going to be so safe.
There are some things that may not go to plan in a home birth. For instance, slow or lack of progress in labour, women wanting additional pain relief options in labour, bleeding issues after delivering a baby.
The emergencies that may come up would be unusual bleeding, excess bleeding, meconium stain in the liquor, things that can be discussed with the woman at the time.
We're very keen to come and support when we need to, knowing we've got a midwife there that is going to be very, very supportive, and if there are other things that are needed from a clinical perspective, we can add those as well.
Immediately after the baby's been born, the midwife's role is to make sure that the mother and the baby are both well and enable that mother to have some uninterrupted time with her baby. This also enables the physiological process of the placenta to be birthed.
Neonatologists are specialists that care for newborn babies. At any point in time through the home birth program, if the midwife and mum has any concerns that the baby is unwell or unhappy, they can call the neonatal team for advice on whether the birth can continue to occur at home or that it's best for baby and mum to actually present to the hospital for ongoing management and assessment.
The important thing, you and Bub will go together. That's it. That's what we want to do. We'll go into the back of an ambulance and then there'll be a steady drive off to hospital with both the midwife and paramedics caring for you on the way.
I think having that close relationship with the woman and her family, it means that we can have those open and frank discussions about changes in risk status, if there's any recommendation that we might have to go to the hospital. But it's always an informed decision with informed consent. It's a women-centred approach.
I try not to put massive expectations on birth because anything could happen. But what I do expect from a home birth is very minimal intervention and that I'm sort of left alone to birth in the way that I want to birth. I will have the support there, which is, reassuring to know that my midwife is there. She's monitoring me, but she's monitoring me from a distance and she's just letting me get on with my birth and how I want to birth.